I'm going to demonstrate how to do an intra-articular injection to this gentleman's right knee. As you can see, this gentleman has had previous surgery, as is manifest with the previous surgical scars around the knee joint. And in fact, he has an effusion within the knee joint, and therefore I will aspirate that effusion at the same time. We can see the effusion by performing a stroke test, which is done by clearing the fluid out of the suprapatellar pouch down into the knee joint, subsequently clearing the fluid from the medial gutter of the knee, and then by running one's hand down the lateral side of the knee, the effusion is seen once again to fill the medial gutter. Similarly, by performing a patellar tap test, milking the fluid out of the suprapatellar pouch and into the knee, and then pressing down on the patella, and one can feel a definite tap as the undersurface of the patella impinges on the underlying trochlear. To perform the injection, I've prepared the following items: sterile surgical gloves, a dressing pack containing skin preparation, which in this case is alcoholic betadine, a needle containing local anesthetic, which in this case is lignocaine, a syringe containing the intra-articular injection, and as in this case I'm aspirating an effusion, I have a 20 ml syringe with a white needle and a sterile pot which I can use to send the fluid off for analysis. We complete the procedure by cleaning the portal once again and applying a plaster. There are two commonly used approaches to perform this procedure. This can either be from the medial or from the lateral side of the knee joint. It's my practice to use that from the lateral side. The relevant anatomical landmarks are easily demonstrated around the knee joint. The lateral border of the patella is easily palpated and can be marked using a marker pen. Similarly, the contour of the lateral femoral condyle can be palpated and marked. On the medial side of the joint, again, the medial border of the patella is readily palpated and marked, and the contour of the medial femoral condyle can be palpated and located with a marker pen. I'm now ready to clean and prepare the lateral side of the knee, which is done in this case using alcoholic betadine solution. The knee is cleaned and prepared over a wide area around the site of the injection, and I can leave that to dry while I wash my hands and put my gloves on. With the knee prepared as we've already described, the procedure itself is carried out. Initially, the area through which the injection or aspiration is to be performed should be infiltrated with local anesthetic. This is done using a 21 gauge needle and lignocaine in this case. The positioning of the entry point is at the superior pole of the patella on the lateral side of the knee joint, between the anatomical landmarks that we've already shown. The skin is infiltrated with local anesthetic using a no-touch technique, as are the soft tissues down to and indeed including the capsule of the knee joint. This can be uncomfortable for the patient, and the patient should be warned about this before the procedure is carried out. Once the area has been infiltrated, the green needle can be left in situ for the administration of the intra-articular injection. In these circumstances, however, as I'm aspirating an effusion which can sometimes be quite turbid, I'm actually going to use a white needle for that procedure and will remove the green needle. The 19 gauge white needle is then passed through the area that's previously been infiltrated with local anesthetic and into the knee joint, again using a no-touch technique. Fluid can be milked out of the suprapatellar pouch and into the knee joint itself with the left hand, and subsequently aspiration is performed gently. With the aspiration of the effusion complete, the fluid can be sent off to the laboratory for analysis, and leaving the needle in place, an intra-articular injection can be given. The needle is then removed, and the area is finally cleaned and the procedure completed with the application of a plaster.